Well, like Dr. Campbell says, warm welcome to today's talk. Today is Sunday, October 15th, 2023. So, welcome, guys. Hey, look, a lot of news lately about statins again. All right, here's my deal. Here's what I logged down on the little finder that says essentially if I should take a statin and why. And so here's the data that I put in. I used the AHA ASCVD risk calculator. They also offer Framingham and Reynolds, but I think the AHA is American Heart Association. So yeah, let's go with the biggies. Do I have a history of prior heart attacks? No. I'm 57, I'm male, I'm white, no smoking, no diabetes. I don't have any bacterial issues, ascites, none of that stuff. My systolic blood pressure is 100. My HDL cholesterol is 55, and my total cholesterol is 230. And I'm currently not on statins. But if I were to take a statin, here's what I could do. According to this, my 10-year risk is 5 people will have a heart attack. Okay, that's pretty strong language for an association, but all right, let's go with it. However, 95 people will not. And if I take a standard dose statin, which costs about $4 a month, so if my math is right, that's a little under $50 a year. Of course, I have to go into a doc, and he has to write me a script, and that's going to run me a copay and all this and all that. So all said and done with follow-ups, this and that, let's just say $200 a year, right? You got copays. You probably have a doctor's appointment every 3 months. They want to look you over, want to make sure you're doing okay, right? Every quarter. And of course, this dose, this will be 1 pill a day. So apparently you get 30 pills for $4. All right, and standard dose statins, the benefits. The use of statins reduces your stroke risk by about 1/5. Well, it also reduced my heart attack by about 1/5 because what they do is they said, if you take the statins, if you're the lucky one out of 5, 4 other people will have a heart attack, and 1 person will be saved from a heart attack. So the relative risk says that I am 20% less likely to have a heart attack out of all of those that will, when in fact I'm only reducing 1 out of the 5 poor blokes that might get a heart attack if I'm in that group of 5. So what that means, sorry for all the numbers this early in the morning, but you have a 5% chance of getting a heart attack if I don't take a statin. And then I have a 4% chance of heart attack if I do take a statin, which means the difference between not taking a statin and taking a statin, I exactly reduce 1 person in the heart attack situation. So here's what I can expect for side effects, which I currently do not have, all right, to potentially save me from 99 other chances that I'm not going to have a heart attack, all right, because I only got to save 1 person out of the 5 who will have a heart attack out of the 100 in the whole pool from the 95 that will not have a heart attack. All right, I'll let you cogitate on those numbers. Nausea, I don't have nausea. Diarrhea, I don't have diarrhea. Constipation, I don't have constipation. Most patients can tolerate. Most means 51%. That means I have a 49% chance of getting this. Muscle aching or stiffness, 5 in 100 patients Some need to stop taking statins because of this. Yeah, what if your muscle aching and stiffness happens in your diaphragm or your heart? Just saying. Liver blood test goes up. Now, I don't know what they mean by the liver blood test, but I'm estimating they mean the AST and the ALT. Mine are currently in the low teens. Look it up. No pain or no permanent liver damage. Well, normally the liver doesn't give you pain. Your gallbladder will, the pancreas will, but the liver generally doesn't register pain. Not that I have ever heard of. All right, 2 in 100 patients. Some need to stop taking statins because of this. Okay, some, which probably means less than 50%, because most meant 51%. So some probably means 49% had to stop doing this. Muscle and kidney damage, 1 in 20,000 patients. Wow, that's a pretty slim risk. But am I willing to have damage to my heart muscle? 1 in 20,000 chance. Or kidneys, which don't like to grow back very well, 1 in 20,000 chance. And this requires patients to stop statins. Now that's once they found out you've already damaged everything. So I get to feel horrible, have nausea, potentially run to the bathroom every 4 seconds, or can't run to the bathroom but every 5 or 6 days because I can't go. I have the chance for muscle problems, stiffness, kidney damage, and liver problems. In order to keep me from getting a heart attack, out of the 5 that will, out of the 95 that will not. Interesting. So what they're going to say is, here's the fun part. If you take the statins, your chances of getting a heart attack will be reduced by 20%. And you're thinking, whoa, 20%. What you're really thinking is, out of the 100 people, 20 of them are going to get a heart attack, and I'm going to be one of the lucky ones. No, what it really means is that out of the 100, only 5 are going to get it, and you might be the lucky 1 out of the 5 that won't. You're still, if I don't take a statin, I'm one of the 95 that won't. If I do take a statin, I'll be one of the 96 that won't. And I can save myself $200 a year, and I don't get to get nausea, diarrhea, constipation, muscle ache, stiffness, liver blood test problems, and muscle and kidney damage. So, after all that is said and done, should I take a statin? Hell no. And here are the rest of my numbers, just in case you want to look those up. Yeah, these are fun. So my real blood pressure is 100/55. That second number is the diastolic. My triglycerides are 88. If you divide that by 5, I come up with the very low density LDL, which is about 17. My total cholesterol, yes, is 230. My LDL cholesterol is 158. And my HDL, which I've already stated, is 55. Now, the triglyceride to HDL ratio is under 2, which means associatively I'm looking really good for not having a heart attack or stroke. My fasting glucose is 74, which means I'm looking really good at not having diabetes. My fasting insulin is 3.2, which means I'm nowhere near getting diabetes. My HbA1c is 3.82. Anything under 5 is golden, all right? I gave you my AST, ALT. I think it was 12 and 13 or 13 and 12. It doesn't matter. It's really low. My waist to height ratio is 0.5. That is golden, all right? That means my waist is about 36 inches, and I stand 5'10". And I think those are the big numbers right there. So Syndromax deals with high blood pressure. Syndromax deals with high triglycerides, low HDL, high fasting blood glucose, and the waist to height ratio. So since I'm in no danger of diabetes, that really does reduce my risk of heart attack and stroke big time. And of course, by not eating much sugar, because I'm a carnivore, 95 to 99% of all my food has zero carbohydrates in it. My chances of getting cancer is slim to none. So should I take a statin? For me, no. Check with your healthcare provider. I'm not a doctor. You're not my patient. I don't know what's right for you. You have a great Sunday. We'll chat soon. Bye. Be well.